Okay, this video is for the Endo Tray Set Up. We have our mirror used to examine the mouth. Then we have our Endodontic Explorer, which is used to locate any openings of small canal orifices. We have blocking pliers used to retrieve any other materials. After that, we have our Endodontic Long Shank Spoon Excavator, and that's used to reach deep into the canal and remove any tissues or decay. We have our Glick instrument, which is used to condense the gutta percha. And then we have the Woodson, which is used to carry or place any materials. Again, we have locking pliers used to retrieve any materials. We have our mixing spatula, used to mix any sort of material that we need to. Then we have our irrigating disposable syringe, and that's used to rinse solution into the canals for debridement of decay. Our HV even saliva ejector used to suck up blood, saliva, excess materials. We have scissors, and that's used to cut any sort of tissues or whatever might be in the way. We have our paper points, and that's used to dry the pulp chambers. We have our anesthetic aspirating syringe that we use to administer the anesthetic. We have our bird block that we'll use with our slow and high piece to remove any tooth structure that we need to. We have our contact applicator that we use with our topical to prepare the patient for the anesthetic. And then we have our air water tips used to rinse and dry. And then we have our dental dam procedure, and that's used to isolate the tooth, the mouth, so nothing gets into the throat, which we have, forceps and the clipper to poke the holes into the dental dam, the frame, the clamp with the floss, and the Woodson to pull the floss through. And then we have our endodontic ring holder, and that's going to hold the brooch, which is used to remove any pulp tissue. And then we have endodontic K-files, and those are used to clean the inside of canal walls. Endodontic files, the headstrom, which are used to clean the inside walls. Reamers, which are used to cut and smooth dentinal walls of canals. Endodontic stoppers that we use to help determine the length of the canal so we don't go too far. We have 2x2 gauze, which is used to wipe up any excess material. And then we have our sensor and x-ray ring that we'll use to take an x-ray during the procedure. And then I'm going to be honest, I've looked at the materials book, looked at the instrument book, I've tried looking at PowerPoints. There's nothing about these three things here. But this little gun type thing, I'm guessing, is used for the root canal sealer to place material. And this, I believe, is cotton pellets in there that you could use to dry up blood from the pulp canals.